Hey, you guys, I'm back. I've been kind of down. Um, just being off social media. It's not my favorite thing, right? Um, I really prefer to be an introvert as much as I'm a loud mouth. And, just processing. Mom passed away in April, and, they're really stuff comes up you don't know. I process differently, and just a little more quiet time, right? That's really important when it's about. I just kind of want to reintroduce myself and give some tips on if you think you have connective tissue disorder or you're thinking you have Marfan's, Ehlers-Danlos, and what you can do. I'm Dr. AmandaLynn Hoffman. Me and all my siblings, my mother and grandparent, although the grandparent didn't know, all have Marfan syndrome. Really rare to have a family that has all of us. Been interested in a long time on finding alternatives, as I wasn't very caring about what the mainstream options were. And in my thesis in med school, I did come upon a lot of different deficiencies that we are in. And it seems to have helped. I have my oldest with our family history of everybody getting Marfan's. Although, it's 50-50 still, but, possibly my children have it milder because of the things I found out in my family. And we've definitely been able to reverse mitral valve prolapse with myself, my family, and my patients. Hold out on a better quality of life. But the big options, the big talk, always is surgery. And that's something that's really personal. And I'm a milder case, so I'm fighting surgery. They all want me, of course, to go get a Teflon aorta, just cut my aorta out and put a new one in. Oh, hell no, I'm not going to go that way. And in fact, I have family members who have watched us all kind of on my side, the ones who are and friends who are, concerned and understandably and such. So I'm just going to do as I do best and keep making my own intuitive choices for my cardiovascular system, as we all have unique cases. So some are more extreme. You might already know you have Marfan. Some might be more milder, like myself. So what can you have your doctor look at? Or, you might work up a little bit and then could do some genetic testing. So first is you're really flexible. You might have been a dancer like me, where being a third generation Russian Baryshnikov ballet dancer was no big deal. In fact, it was the best thing to make me build muscle, especially through those teen years to early 20s. Whatever we can lay down is going to save us in the long run. Don't let your teenagers sit around. Get them out building muscle, especially Marfan boys are very smart, and they're going to want to be on the computer, but now's their time to lay down muscle. So the flexibility is a huge one that you might just kind of start noticing, or maybe you think that's fairly noticeable, normal. Being flexible is kind of more of a getting to be more socially accepted. If you're freakishly, then not so much, but things like this and this, these are signs that you have a little bit more than most people. I've run into a lot of people noticing their GIs are off first, really leaky guts because we're very loose. So I work more with that, or pain, musculoskeletal pain that you just can't handle all the time. Hence why you don't always see me. I'm doing so much. I've got to do my self-care or my pain kicks up, right? We only have so many spoons a day, and it's insane. So another marker is you can easily wrap yourself around your wrists, your own fingers, because our fingers are arachnodactyl spider fingers. Really kind of cool. You can do this with your thumb, where it can come all the way out to the other end. That's a thumb sign. So those are worth more points for the kind of Beighton scale, we call it. We'll use Marfan's and Ehlers-Danlos for similar workup, but their etiologies are entirely different. I treat them very differently. We all got lumped together when I was a kid and, you know, the Marfan Foundation, and they're so extremely different. But I've learned a lot with Ehlers-Danlos, not having it be similar enough, nobody else is noticing it, but it's blowing up like crazy. Ehlers-Danlos is everywhere. Seems to be these genetic things are getting triggered with all the amount of toxins, our inability to release toxins, which I really find is fascinating and important to find out as a detox focused naturopath, old vitalist, where I do believe in just going as natural and less, you know, be more conservative, less invasive outside things. I don't take losartan every day. You know, it's one of my things as a Marfan's. Maybe if I feel like my blood pressure might be getting too high, like when I had to do my CT scan, then I had to do it. But yeah, I'm a doctor. I'm a horrible patient. All right, so there are some differences in the way the shape our hips are. This is going to be easier to see. Some scoliosis, excavatum pectus or excavatus. That's the chest goes in or out pretty extremely. Her hip bones are a little different. Scoliosis is definitely an issue, and you get quite a bit more. Look at this gal. She looks like she could be my family member. She looks like somebody in my family. Very nearsighted. We have long eyeballs. Your arms are longer than your height. That's a good point. The scoliosis there. Up here, we're also seeing this rolled in ankle. We'll have heels are really high arched. The palate of our mouths extremely high arched. A lot of other signs. These are just some quick ones. Mitral valve prolapse. That means a little bit of your blood goes back in your heart because we have really long, like wings or something, of a butterfly that will close a little bit, but not. This one I've reversed and it comes back, and I reversed on myself quite a bit. So I don't take all my stuff all the time. I believe in kind of taking a break too on things. All right, so my Ehlers-Danlos, they'll have like their shoulders can dislocate. Their skin is hyper flexible. It can pull out the skin off your, like super velvety soft. That's another sign for Ehlers-Danlos. That just means like all their tissue inside is really soft. So those GI swallowing issues, prolapses with bladders and vaginas happen very easily. With men, other, you know, things hanging down there. Can be extra stretchy. So Marfan's, another way is genetic testing. Thanks to Lynn Sakai up at OHSU here in Oregon. We know the gene. And Vitae and Vitae, we invite you to do. There is a whole connective tissue panel. If we're not quite sure where you might be at, there's an Ehlers-Danlos tissue panel and there's a Marfan one. They all run the same price, so it's very affordable. Actually, the lab is $250, and that's me just telling you the wholesale my price. No interpretations or anything done, but that's a nice way to work up the scary Ehlers-Danlos. Most Ehlers-Danlos out there is it's a hyperflexibility, but it definitely will cause vertigo because your whole spinal fluid is off. Ours gets that way too with Marfan's. Lots of different kinds of pains and along the spinal cord. And these are definitely things I see a lot. I feel like I have some in the base of my neck from snowboarding, stupid stuff. Don't do what I do, you guys. I'm learning the hard way so I can help teach you what not to do. So those are some ideas for working up on these connective tissue disorders. You have no idea. You could just do the connective tissue disorder panel to find out genetics. Now that would not tell you just the hyperflexible syndrome disorder or Ehlers-Danlos hyperflexibility. So that's where some help with somebody who can guide you a little bit more through the Ghent criteria, Beighton criteria. Doctors, those are what you're going to be wanting to look up my physician friends out there. The Ehlers-Danlos Society has all of your scoring pads on there, you know, so you can, and here's like the Guyton one off of the Marfan's Foundation site. So these organizations, these foundations have done amazing jobs helping be resources for us physicians on the testing that needs to be done and the proper workups there. And then from there on, always a good idea to possibly hand over to a cardiologist or specialist. Otherwise, anybody has any further questions, please hit me below. Share this with anybody you think who might be a little concerned about what's going on with them. And I have resources out at calypsonaturalclinic.com for a free how to eat and what you feed your kids. And then Dr AmandaLynn, LYNN.com, for my book on loose connective tissue support. I want to get this naturopathic medicine side of things out there for people, as it's it's the oldest medicines and it's the safest. I love it for my children. From homeopathy to nutrition to just our lifestyle and making sure that, you know, we do safely exercise and stretch. And I love to help move us all towards a better quality of life. Excellent. Please feel free to connect anytime. Take care.